Hello, my name is Lewis and I'm a podiatrist at East Coast Podiatry in Singapore, and today we're talking about shin splints. Shin splints is a very common lower limb injury affecting runners, mainly adults, but we do see this in children as well in rare cases. Shin splints, or otherwise known as Medial Tibial Stress Syndrome, is a chronic overuse condition experienced by many runners. Usually this will present as pain in the front of your shin or near the shin bone whenever you're running, normally during and also after running as well. Shin splints does refer to muscle and tendon and sometimes bone overuse, and it can be an indicator that you're putting too much stress on your tibia bone. Now, there can be different reasons and different causes for this. Usually it's because your muscles are very tight, okay? And often as well, it's always linked to patients that have increased their activity far too much too soon. So it's very common with new starter runners or people who are quite new to exercise or running, or for example if you're increasing your activity in goal training for a marathon or something like that. True shin splints is a osseous condition, which means you get inflammation and irritation of the periosteum of the bone, but it's much more common. What we see is actually overuse of the anterior shin muscles, such as the tibialis anterior, also the medial part as well, the medial compartment, which is the posterior tibial tendon. So symptoms will present as sharp pain, usually on the inside of the tibia bone, moving up the leg towards the front of your shin. Normally this will be much worse when you are exercising or running on an incline. So incline walking or running uphill or even hill sprints, things like that, can put a bit more stress on the medial compartments. And this can sometimes cause some swelling, and we can get some nerve compression and what's called compartment syndrome, which can be a very serious condition. Okay, so with shin splints, we often see patients who will complain of pain along the front of the shin here. So this is the shin bone, the tibia, and pain can often be on the inside of the tibia, okay, all the way up here. We can see some medial compartment, some pain and tenderness when we press on the muscles here. Often as well, we can actually see pain just at the front of the shin bone on top here. The tibialis anterior muscle runs down the front of the leg and can often be overused in a common running injury. Shin splints is very common with patients who have increased their activity suddenly. Often I see patients that complain of shin splints if they've started to do any sort of incline training, because when we're running on an incline, of course, we're stretching the foot more and dorsiflexing the ankle more, and you can see the tibialis anterior muscle actually connects here, and you can see if you just relax your foot from here and then pull back up again, if you try and raise the foot, you can see here the tibialis anterior, and we can follow that all the way up the leg, all the way up to the muscle belly up here. Okay. During your exercise or even afterwards, if you get sharp pain in the front of your shin, the best thing to do is reduce your activity right down. Sometimes we have to stop activity for a short while as well and apply a cold compress or ice pack, something like that, to try and reduce the inflammation and reduce your symptoms. For us, what we want to do is we often see patients that have this that comes and goes when they exercise, been on and off for a couple of weeks now, and then they will normally come and see us around that point. What we want to do is we normally want to address the root cause of this. So why is this happening? Most likely because, number one, muscles are tight. Number two, shoes can often be inadequate, and very common as well, we see a hypermobile flat foot. Things what we can address is, number one, the advice and the education is what we want to give to the patient to understand the condition, why is it happening and how can we fix it. So normally it would be a case of educating the patient on the exercise program. So if you're doing too much exercise too soon, or increasing your activity or changing your activity, for example going from jogging lightly to doing fast interval training or hill sprints, can often be a trigger. So as podiatrists, number one, we would educate you, talk about the different things that we can do and how we can help. And number two would be to look at the overpronation of your foot, or a lower arch foot. So in that situation, what we would do is we would look at a custom-made insole inside the shoe. Something like this would go inside the shoe, but it will be custom-made for you based on your height, your weight, your activity, and your footwear as well. So it's really important that it's custom-made for you. Once we've made the insole, we fit inside the shoe. So normally we would look at some footwear advice as well. Most people will benefit from a change of shoes. We just want to build up gradually to return you back to your exercising. In some cases, shin splints can be a medical emergency in the form of a compartment syndrome, where the muscles will swell and compress the arteries to the lower limb. So this is very, very serious. So if you do get sharp pain when you're running on the anterior shin, you do need to stop immediately and put some cold compress on there. So I hope you found this video useful. If you've got any questions at all about this condition or any other lower limb condition, please let me know in the comments below and we can address it in the upcoming videos that we'll be doing. Thank you.
For more information on related conditions, check out our other videos.